Hi, I'm Dr. Rani Kapadia, and I just want to tell you what to expect for your upcoming lumbar puncture appointment. As you may know, the brain is connected to a spinal cord, and these structures are surrounded by a sac. You've probably heard about this sac before. It's called the meninges. It's made up of several layers. You may have heard of children and adults getting meningitis. That's inflammation and infection of the sac that lines the spinal cord and brain. And often we do this procedure to look for infection in meningitis. Within the sac, it's a bit of a closed system, and there's fluid within it called the cerebral spinal fluid. We abbreviate that CSF. That's what we're going to measure the pressure within today, and also we're going to take a sample of that fluid. The spinal fluid, the CSF, is made by the brain, and it's absorbed into the venous structures of the brain and back into the body. And so some patients can have high pressure problems from too much production of spinal fluid, or perhaps an obstruction in the absorption of the spinal fluid. Other patients can have low pressure in the spinal fluid from tears in the sac, whereby there's leakage of the fluid. But the main reason we often do lumbar punctures is to look for clues if someone has infection or inflammation of the brain and spine. Because the brain and spine are constantly bathed and surrounded by this fluid, there's a lot of things we can test for. The mechanics of getting the fluid sample is by doing the lumbar puncture, which is putting a small needle into the lower back and into the lower part of the sac, pretty much where the sac terminates at the bottom of the canal. It's important to know that where we put the needle is well below the spinal cord. In most patients, the spinal cord ends at about L1, L2, and typical areas where we would get the sample is at the level of L3, L4, or L4 and L5. That's important because the word spinal tap and lumbar puncture often conjures up scary images of punctures into the spinal cord, but that's not the case. And in fact, we want to go where the sac terminates. That being said, there are nerve roots destined for the legs that go through that sac, and sometimes when we enter the sac, there can be a brief pins and needles on either the right or the left side, but that's often transient. So the mechanics of doing the lumbar puncture is that it first requires you to change into a gown so that your back is exposed. Then we'll position you in either one of two positions. You can be laying on your left side in a cannonball kind of tuck position, or you can be sitting upright and flexed forward. The position will be dependent on whether we need to get a pressure measurement and also due to your comfort. After we've positioned you, we'll examine your back to try to understand the best place to put the needle and get the sample. Once we've determined that, we'll make a small marking on your back with a marker to help us understand where we're going to get the sample. After that, we'll clean the skin with an antiseptic solution. We'll put in a little bit of freezing, just like the kind you'd get at the dentist to freeze the skin and the softer tissues, and then we'll give that some time to take effect. That part stings a little bit, but that should be the most painful part of the procedure. After that, most people notice pressure. They know that something's happening, but it shouldn't be painful. This is not meant to be an overly painful procedure. Once the freezing's in, we use a longer but much tinier needle to get that sample through the sac. After we have you lay in the clinic for 5 or 10 minutes to rest, and then you're free to get changed and go home. There are risks to having this procedure done that you should know about. First and foremost, there is a risk of having a headache after this procedure. Typically, about 10 to 15% of patients will get a mild to moderate headache after the procedure lasting 1 or 2 days. It's often made better by using over-the-counter medications like Tylenol, Advil. Sometimes caffeine like coffee can help, and laying flat is often helpful. The reason people get a headache after this procedure is that we're puncturing through the meninges, the sac, and there can be some transient low pressure in the system, and there can be some transient leakage through that puncture. Majority of patients don't have any problem, but again, 10 to 15% of patients will have some mild headache. In less than 1% of patients, they'll have a persistent leak through this puncture, and they'll have quite a severe headache, sometimes lasting days to weeks. If that happens to you, you need to seek medical attention by contacting your referring physician or go to the hospital or urgent care. Other possible complications is that you may have some low backache. By this I mean, when you push on the area where we get the sample, it may feel like a bruise. You shouldn't have any more pain than that. Moderate, severe pain or any symptoms in the legs demands medical attention, so you should go to the hospital or the urgent care center. Whenever we put a needle through the skin, there is a risk of bleeding, infection, and in this situation, we mentioned nerve injury as well. These risks are quite rare. We check your blood test before you come to the clinic to make sure that you don't have any abnormal clotting proteins, and we ask for you to let us know if you're on any blood thinners. We do everything in this clinic under sterile techniques, so the risk of infection is very low. And again, as I mentioned, people worry about nerve injury as a common complication, but it's actually quite rare. And most of it has to do with where we're getting the sample from. The final risk is being unsuccessful. By that I mean you've come to the clinic, we've tried to prepare you for the procedure and put in the freezing, and we weren't able to get the sample or measure the pressure. In our clinic, we're about 97% successful, but that means about 3% of the time we're not successful due to anatomical reasons. For example, if we find the curvature of your back, we may not proceed with the procedure. Alternatively, sometimes we think that it's going to be successful, but there's some anatomical change that makes it not possible. In these situations, we may ask your referring physician to send you to a radiologist to have this done under X-ray guidance. Your own comfort is another reason that sometimes we cannot get the procedure done. If somebody is overly anxious or still having a lot of pain despite local anesthetic, we will just stop the procedure and find another way to do it. After the procedure, we will let you know the immediate result of the pressure reading that we take if that was requested. We'll also send a letter to your referring physician that we saw you today, we were able to do the procedure successfully, and what the pressure is and how much fluid we took. The fluid will be sent to our local lab for the requested testing by your referring physician, and you can expect for the majority of tests that you'll have the results within 2 weeks. For some specialized testing, that time frame can be a bit longer. It can be up to 4 weeks.